A beginner's guide to essential health screening tests for women. Women's health changes as they age. They are more prone to some health issues when reaching a certain age. Therefore, the precautions they may need to take to maintain their health may differ based on their current age. This video shares some screening tests women in Singapore should regularly take, depending on their age. Women in their 20s. Women in their 20s, especially those who are sexually active or had past sexual encounters, should get tested for cervical cancer since they are at risk of being infected with the HPV or human papillomavirus. HPV is a type of virus that can cause precancerous changes in a woman's cervix, leading to cervical cancer. While the Pap smear test is relatively painless, some women may feel a bit uncomfortable. During the test, cells will be taken from the vagina and cervix to be tested for precancerous lesions. Another test women may need to take when they reach this age is the blood pressure test. Women with high blood pressure will place more strain on their arteries and heart, and if they do not take measures to control their blood pressure, their arteries get damaged and become weaker over time. Women in their 30s. Apart from the Pap smear test, women in their 30s should consider opting for the HPV testing to detect HPV strains that may cause cervical cancer. Specifically, these strains are types 16 and 18. Recent research found that HPV infection precedes most cases of cervical cancer and carcinoma in situ. Women who tested positive for HPV would be referred to a recommended women's clinic Singapore or gynecologist for a more detailed cervical test. If the result is negative, they should repeat the test every 5 years. Women in their 40s. Essential health screenings women in their 40s should take are screenings for diabetes mellitus, cholesterol, and breast cancer. The test used to screen diabetes mellitus is the fasting blood glucose test, while fasting lipid blood test is used to screen for high cholesterol or hyperlipidemia. On the other hand, tests to screen for breast cancer include a mammogram and clinical breast examination. Women should get tested for fasting blood glucose and lipids once every 3 years and once a year for breast cancer. Women in their 50s. In addition to breast cancer screening, women who are 50 years old and above should also opt for a colorectal cancer screening exam. They may take the fecal immunochemical test and colonoscopy once per year and the computed tomography and colonography once every 5 years if their initial test results are negative. Moreover, women in their 60s should, as advised by their physician, take eye examination to screen for glaucoma, which is typically known as the silent thief of sight. Women in their 60s. Women aged 65 and above are recommended to get the bone mineral density scan to screen for osteoporosis, a disease where the bone becomes less dense and brittle. The test's frequency will depend on the recommendation of their healthcare providers. Different Singapore women's clinics offer different women's health screening packages. Women should take their time to determine the types of tests they need and look for a clinic or health center that provides the necessary tests within a competitive price point.